Hi, my name is Nirtal Shah. I'm the external apper for the course. I'm also a physiotherapist and a part-time master's student in public health. And these are my partners. This is Alex and this is Nate. We're both master's students in computer science. We all wore shorts and we decided that Nate had the nicest legs, so that's why he's up here. So the motivation for this app basically comes from my work as a physiotherapist and my treating patients that have torn ligament in their knee called the anterior cruciate ligament. It's one of the 4 ligaments in the knee. And you may have heard of it in the sports news. These are all famous athletes that have torn their ACLs and then thus had it reconstructed. So this is all stuff that you may have heard of in the news. But in terms of the normal everyday person, in the US alone, there's 100,000 people that have this knee ligament reconstructed every year after it's torn. And the recovery after surgery lasts about 6 to 8 months. And the cost in Canada alone is in the range of $3,500 to $4,000 just for the rehabilitation. In the United States, it's significantly more. One of the main components of this rehabilitation is to measure and determine how far the knee bends, what we call knee range of motion. A relatively simple thing that we do in the clinic with something like this called a goniometer, just a fancy protractor. And we do this to make sure that people are not falling behind their post-operative goals, to make sure they're attaining the range of motion that they need to attain. And if they don't, they can have negative consequences in terms of not being able to return to sport, physical activity, or even long-term consequences that impact their walking, stair climbing, things like that. So that's where we came up with the idea for MyKnee. I have patients coming in all the time where I measure their movement and I send them off and say, you're 20 degrees behind, you need to do these 4 things and come back to me in a week. And we thought MyKnee would be a great extension where the patient could monitor and watch their progress and measure their own range of motion by themselves.
Okay, in our design, we are using the gravity sensor and accelerometer to calculate the angles. As you know, the gravity sensors are embedded in almost every smartphone, and it has 3 directions, X, Y, and Z. In our calculation model of the first method, the linear stomach method, the yellow lines represent for the patient leg, and the smartphone is attached. Then we can get the values of X, Y, and Z, and we can calculate the gravity G by using the formula shown here, and by doing this, in this case, the range of motion is equals to the right angles, which equals to the green angles as well, the green angle alpha, because both the right angle and the green angle equals to the 90 degrees minus the angle beta. We can get the green angle by calculating the arc sine y divided by g. This is the big picture of our calculation model. And in the calculation model of our second method, the lining on back method, is quite similar with the previous model. And in this case, the range of motion is the sum of 2 right angles, and it equals to the sum of 2 green angles in this case. And we can use the similar way by using the smartphone and the external sensor to calculate these 2 green angles. Right now is the time for a live demo. Okay. Yeah. Then we can start. We can start our app, and this is the welcome page. Let's just start it. We go into, because it's our first time to use it, we directly go to the profile page. In the profile page, right now we just enter the age is 28 and the sex is male. And we suppose the Nate has the surgery 1 month ago. We just enter the date. It's 1 month ago, and we start ready to measure. And we have the different settings here. Here we have 2 methods for the feedback. We have the speech and the vibrate. For this measurement, I just turn the speech on and the vibrate off. And we can use the gesture on and the button off right now. Okay, we just ready to measure. We use the first method here and begin to measure. No, not yet. Okay. And here, we can just double-click the screen and start. Yeah.
So go ahead and bend your knee as far as you can.
Yeah.
So he's a month out of surgery. He didn't see his physiotherapist, so he really doesn't have very great knowledge. Let's see how he's doing right here. And I promise not to look at the screen.
Yeah.
He has 69 according to my measurement.
Yeah. It's 53 right now. Here.
Okay. So we're off a bit, and we'll talk about our clinical trials in a minute. And then if we look at the next page, so if can we check his progress?
Yeah.
So
right now we can use the second measurement to test, and right now we can just edit the profile page. We assume he is 16 years old.
Sorry, just a quick note. So that screen that flashed up there a minute ago, you saw that he should have been at about 140 degrees. So a month out after surgery, he should be at 140. He's obviously quite behind. And we put those benchmarks in there, which we'll talk about in a minute.
Okay, and we can turn on the sensor. Start to measure.
No, I need to turn back.
Yeah. Oh, yeah. As you know, we have our own sensors called MyKnee sensor 1, and we just connect it. Okay, and we have a button here, and you can use this button to turn on or turn off the sensor we just show here, and yeah. Oh. Oh, probably. Okay, let me see. Yeah, just turn on the sensor, and we can find our sensors here. Oh. It's here, yeah. Oh, yeah, the sensor is open. Yeah, the sensor is open right now. Okay, and we can start to measure, and then you can end it. Yeah.
Okay, so there.
Can stop.
So I'm measuring him at about 119 degrees.
Yeah, it's 113 here. Okay. Yeah.
Okay, so very quickly, so those are us just trying the app here, and this is my clinical trials of actually using the app. So I tested the app 60 times, 30 times in each position, so position 1 on the stomach and position 2 with the 2 sensors. And what you see here are the 10 subject numbers at the bottom and the mean and standard deviations along the side. And obviously you can see with the 2 sensors we had more higher errors and higher standard deviations. Overall, the mean results were 5.13 degree difference between my measurement and the phone's measurement with the person lying on their stomach, and 7.03 with the person on their back. If you look at the research, it basically suggests that if I measure the same angle twice, I'm going to be about 3 degrees off. And if 2 physiotherapists measure the same angle twice, they're going to be about 6 degrees off. So we're in the range, but I'd like to be a little bit closer. And I think there's some reasons for these errors. And the main reasons are that one of them, possibly that the person couldn't hold their leg still. The second one being that I could have been off. I might not have been as consistent measuring the angle. The third one, I think with the 2 sensors, we're dealing with more noise, and that's why we're getting perhaps more differences in our clinical trials. And the last is that perhaps the app is miscalculating, and that's something that we need to investigate further as well.
About key learnings, a lot of things we have learned, and there are 3 we want to mention. One is that we want to spend more time testing the app on subjects. Another is we want to ask the patient to try our app first during we are developing the app. The third one is we want to try a different external sensor, since this sensor need to use with a phone with version 4.3. And future work, we want to do some research about validity and reliability and usability test on patients. And we want to expand the use of MyKnee to other joints like arm, things like that. And we want to have the app provide method for the patient to suggest them how to increase the knee's range of motion. And the final thing is that we want to release the app in the Google Play Store several months later. Thank you.
It's a little longer than usual. We'll have maybe one or two questions, if not. Yeah, first.
For your clinical trial, did you try it with able-bodied subjects, or is it patients?
No, they were all able-bodied subjects. So we just tried it on just people that could bend their knee, had no problems bending.
Do you think there would be any difference if you were testing it with the subjects that you were aiming for?
Probably the only difference would be their ability to hold that position. In terms of the angle measurement, I think the error would be about the same. That's my guess. Yes?
Yeah, I think for future versions of the app, it would be really cool if you can get the data from the phone from a different device, and so that you can also control the phone from a different device. So you don't have to try to use it while it's on a.
Great, thank you.